Hello, welcome. I'm Dr. Yasin Mustafa Joshua from Tanzania. Today we'll be talking about diabetic neuropathy, a very common complication in diabetic patients. So throughout this video, we'll be talking about what is diabetic neuropathy, what are the symptoms, when should you go to see a doctor, and what are the possible complications, and what are the possible treatment and things to do so that you can minimize or you can minimize the risk of getting diabetic neuropathy. So what is diabetic neuropathy? Diabetic neuropathy is a nerve damage that develops gradually due to chronic high blood sugar levels. While it often targets sensory and motor nerves in your legs and feet, it also impacts the nerves regulating with function of your heart, so which controls the heartbeat, which controls digestion, the bladder. So what are the possible symptoms of diabetic neuropathy? The symptom depends on the type of neuropathy you have. Peripheral neuropathy, this is the type of neuropathy which medically is also called the distal symmetrical peripheral neuropathy. It's the most common type of diabetic neuropathy. It affects both the sensory and motor nerves. The symptoms, it depends on the type of nerve affected. If the sensory nerve is affected, the most presenting symptoms will be numbness, tingling, burning sensation, and sharp jabbing pain in the feet or hands in a glove and stocking pattern. But if the motor nerves are affected, these are nerves which control the muscle movement. So it may lead to symptoms of muscle dysfunction, for example, muscle weakness, muscle cramping. It also can present as both the sensory and the motor part also affected. So it will have overlapping symptoms of sensory and motor nerve damage. So the second type of diabetic neuropathy is called the autonomic diabetic neuropathy. This is type of diabetic neuropathy due to the damage of nerves which are responsible for involuntary actions of our vital organs, for example, the heart, the digestive system, the bladder, the genitalia, and the reproductive system, and the sweat glands. If the digestive system is affected, the patient may present with increased or decreased motility. So it may present with painful swallowing, regurgitation, constipation, or diarrhea. But also, if it affects the cardiac or the heart, the symptoms may be of irregular heartbeat, which may cause fainting, may cause lightheadedness. The cardiac neuropathy may lead to a silent heart attack and may be fatal. When it affects the sweat glands, it hinders the ability to produce sweat and hence poor body heat regulation. Symptoms like dry skin, cracked skin due to inability to produce sweat, heat intolerance, and abnormal sweating patterns, such as facial sweating during eating, may signify sweat gland nerve damage. The other type of autonomic diabetic neuropathy is urogenital nerve damage. The nerves responsible to control your urinary system, the bladder, may be affected, and you will have symptoms, for example, infrequent voiding, painful micturition, increased urgency, nocturia, incomplete bladder emptying, and poor stream may present. But also, it affects the reproductive system. So in men, it presents as erectile dysfunction. Also may present as retrograde ejaculation, but in females, it may present as inability to produce vaginal lubrication, hence painful sexual intercourse. If you have diabetes, that's one risk, that's an independent risk. But not all diabetic patients will get diabetic neuropathy. So what are the risks which will make you one of those having diabetic neuropathy? The first thing is long-term poor glycemic control, predispose you to nerve damages. And also, if you have a long history of diabetes, you have been living with diabetes for a long period of time, that might also be a risk. And The kidney diseases may also predispose you to diabetic neuropathy, or being obese and overweight, but also smoking and alcohol may predispose you to diabetic neuropathy. When should you see your doctor? Of course, you should be seeing one. In our practice, we see one at least once a month if we are diabetic. So you should be seeing one. Whenever you get a diabetic neuropathy symptom, for example, severe neuropathic pains, the tingling or burning sensation in your feet and your hands, a sore or a cut or a wound which is infected, which doesn't heal, a change in your bowel habit, a change in your micturition habit, fainting or lightheadedness. If you get acute pain after intensification of treatment, you need to see your doctor urgently. The symptoms of diabetic neuropathy overlap with symptoms of many diseases. So your doctor will ask you a lot of questions so that he can rule out the other possible causes of your neuropathies. We have special investigation for diagnosing diabetic neuropathy. It depends on the neuropathy. If you are presenting with the sensory or peripheral neuropathies, so we have the monofilament testing. This is a soft nylon fiber which is brushed over your areas of your skin to test your sensitivity to touch. But also we have some more advanced testing procedures and investigation, like the nerve conduction test, which it measures how quickly the nerves in your arms and legs conduct electrical signals. Or we have electromyography, which it's done along with the nerve conduction test, and it measures electrical discharge produced in your muscles. But treatment of diabetic neuropathy, it has goals. It aims at slowing the progression of diabetic neuropathy, relieving pain or managing symptoms, and manage complication and restore functions. So the all treatment will be aligned in those goals, but will not be reversing the already presenting diabetic neuropathy. Most of the medication will be given will be aiming on relieving pain and symptoms, the tingling sensation, the burning sensation, or the neuropathic pain in general. The other management, it will be managing complication and restoring function. This mostly when you have autonomic neuropathy, restoring your normal digestive function, restoring your normal urinary function, restoring your normal blood pressure function, or sexual function, proper glycemic control. So it should be noted that glycemic targets are individualized according to your age, according to your comorbidities, according to various factors. You should talk with your doctor. Foot problems, including sores that don't heal, ulcers, even amputation, are common complication of diabetic neuropathy. But you can prevent many of these problems by having a throughout foot exam at least once a year, as recommended by American Diabetes Association. Also, have your healthcare provider check your feet at each visit. You should be checking your feet every day. Keep your feet clean and dry. Wash your feet daily with lukewarm water and mild soap. Don't soak your feet. Dry your feet and between your toes thoroughly. Moisturize your feet. This helps prevent cracking, but don't get lotion between your toes because it might encourage fungal growth. Trim your toenails carefully. Cut your toenails straight across. File the edges carefully so that you don't have smooth edges. If you don't do this yourself, a specialist of foot problem or podiatry, if you have in your practice, can help you. Look for socks made of cotton or moisture wicking fibers that don't have tight bands or thick seams, which may prevent blood flow to your feet. So wear a cushioned shoe that fit you well. Make sure your shoes fit properly and allow your toe to move. Many symptoms presenting the diabetic neuropathy are overlapping with symptoms of other diseases. But also there are some drugs, some habits, some foods which may also present with the same symptoms as diabetic neuropathy. So expect your doctor to drop some medication, maybe antihypertensive. There are antihypertensives which also cause diabetic neuropathy, like sexual dysfunction. Diabetes is a chronic disease. It needs a chronic attention. So thank you for watching, and remember, you are not alone in this journey.